Hi everyone, you're going to be following along with me today doing 3 exercises. These are physical therapy exercises that target the deep core and deep pelvic floor musculature. So we're going to be addressing things today that Kegel exercises don't address. So all you're going to need is a wall and something to lie down on. So let's get started here. I'm going to have you lie on your back and we're going to start with the breathing technique. Did you know that our breathing is coordinated with our pelvic floor? As we exhale, the pelvic floor relaxes. So let's activate the pelvic floor. Now, if you're new to pelvic floor, you want to just imagine the material, the soft tissue between your sit bones, and then running back and forth from your anus to the urethra. That whole area is the pelvic floor, and that's where we're going to be tensing and tightening and toning today. So with the breath work, one hand goes on your belly, the other hand is going to go on your rib cage, and I'm going to do a practice run here, so follow, just watch, and then we'll do it together. You're going to take a nice deep breath in through your nose. It's going to expand your tummy and your rib cage like a balloon or like an umbrella. And as you're breathing in, I want you to really feel how your pelvic floor is releasing. On the breath out, it's going to be through closed pursed lips like this. And as you're breathing out, you're going to tense that whole pelvic floor area by visualizing the very center of it coming up inside and into just the area behind your belly button. So you want to tense all of that and visualize it you're bringing up the pelvic floor to end up behind your belly button. All right, so here we go. Hand on your tummy, hand on your rib cage. Big breath in through the nose. And purse lips and tighten that whole pelvic floor. See it coming up if you want to visualize while you breathe out. See it coming up. Keep breathing out and bring that pelvic floor up, inside, and behind the belly button. And relax. Very nice. Let's do a couple more. Keep training, and I want you to get the feel of where your pelvic floor muscles are. All right, second one. And deep breath in through the nose. Felt that relax in your pelvic floor, and now tighten the pelvic floor. See yourself bringing that tissue up inside, up all the way. Keep going until it's behind your belly button, and relax out. Very nice. Let's do one more. Pursed lips, breathing out while you tighten between the sit bones. You're pulling between the anus and the urethra, drawing that pelvic floor up by tensing it. Tighten it. There you go. Tense it. Bring it up behind the belly button. Keep going. Get all the way up there and let go. Very nice. All right, here we go again. You can do it. Keep visualizing. Hold on to that. If you lose the contraction, just go back again. Pick it up again. Hold tight. Pull it. You're pulling. You're bringing it up almost like you've got a zipper, zipping everything together up and behind the belly button. And relax. Very nice. Okay, let's go to our next exercise. In these exercises, the glutes want to activate. And in this particular exercise, they will activate, and that's okay. On traditional other pelvic floor exercises, we try to work, and not, you've probably heard, don't use your glutes, but in this one, you actually will be using it because we're going to do a bridge. Okay, in this position, all I want you to do is tighten your pelvic floor. And as you tighten, once you get it tight, you're going to lift. And of course, you're going to use your glutes, and we're going to hold here for the count of 3. And we're going to slow lower. All right, let's do 9 more of those. Tighten your pelvic floor. Get that tissue tightened, pulled up behind the pubic symphysis. Keep going all the way up to your belly button, and hold that while you lift. And 1,001, 1,003, good. And come on down. All right, it's really important to hold that pelvic floor in as we move through it. Here we go. Pelvic floor tenses, and you're lifting, tightening the glutes, keeping the pelvic floor tense, and lower. Nice. Okay, you've got it. And start with the pelvic floor tissue tensing. Good. And now we're going to add the lift. Glutes are activated now with it. Really hold it there, tighten them all, and now lower. All right, let's do 6 more. Tense the pelvic floor muscles. Lift, squeeze your glutes while you're using your pelvic floor muscles. And very nice, come on down. And again, activate those pelvic floor muscles. Tighten, lift, squeezing the glutes. You've got the pelvic floor tight at the same time. And come on down, very good. And again, pelvic floor, lift with the glutes. We're doing this because we want to activate the glutes and the pelvic floor together so that they work in our daily activities of reaching, pulling, pushing, walking. They're supposed to be coordinated. So we're going to help them learn to work together. Pelvic floor, tense and tight. I added a pelvic tilt there. You can, you don't have to. Hold that tight, that pelvic floor. Okay, come on down. Let's do 2 more. Pelvic floor tenses and tightens all the way up to the belly button. Engage the core now with the glutes. Good. And last one. Pelvic floor tenses. Lift. Keep the glutes engaged. Very nice. And come on down. Good job. Okay, this last one is where you're going to need your wall. So you're going to kind of shift, go close to your wall, and you're going to take the foot closest to the wall and use the outer side of the foot to press into the wall. So I'm going to keep my leg up for just one of them so you can kind of see. So in this position, the outside of my foot is pressing against the base of the wall, and I'm contracting at the same time. So during these, we're going to do 10. During them, you won't see a lot of movement because there's not a lot of movement going on. This helps get the deep core pelvic floor, and it also helps get some of the hip stabilizers. All right, so in this position, get your pelvic floor tense, and now gently just push against the wall like you're trying to push it away from you. You'll feel a little bit of the side of your hip engaging. That's okay. And relax. These are all 5-second holds. And again, engage your entire pelvic floor. And now press the outside of your foot against the wall, against down here, probably where your floorboard is. And relax. We're getting that deeper lateral wall of the pelvic floor right now. And again, tense up. Pelvic floor is nice and tight. Now add your pressure on the lateral foot against the wall. And relax. If you can't remember what to do, always start with the pelvic floor, always end with the pelvic floor if you can't remember everything else. And again, tighten the pelvic floor. Got it? Good. Press the foot out. Maintain the squeeze all the way from the perineum up behind your belly button. All of that whole distance is tight. And relax. And here's number 5. Pelvic floor tenses. Press against the wall. You're doing good. And relax. And again, tense pelvic floor. Press. And relax down. Good. Number 7, tension in the pelvic floor all the way up behind the belly button. Press. It's a gentle press. You're just activating the muscles for the pelvic floor, for the deep core. And relax. We're just reminding them they are all supposed to work together. Again, tension down into the pelvic floor muscles. Now push out. And relax. Let's do 2 more of those. Tense the pelvic floor. Push out. Good. One more time. And just as a visual reminder, when you're tensing the pelvic floor, bring those sit bones together in the distance between the anus and the urethra together. So here we go. Tighten, tensing that area. You're pulling it up. Push your foot against the pelvic floor, against the wall. and relax. Very good. So we want to go around and do the opposite side on the wall. So I'm just going to switch. Bring my pillow with me. You can use a pillow, you don't have to. It's up to you. It's just comfort measures. Same thing, and I'm going to get a little closer to the wall. And ready? Here we go. Okay, foot's against the wall. Tense up in the lower abdomen. Tense up in your pelvic floor. Good. And now press the foot into the wall. And relax. And again, tension through the pelvic floor. Bring that the two ITs, we call them ischial tuberosities, but it's your sit bones together, draw them from the front and back, pressing the leg in, pressing your foot in, and relax. Again, add the tension to the pelvic floor, bringing it in, press that foot out, hold everything together, and relax. All right, here we go. Number 4, tension and press together. Everything's working on the pelvic floor, lateral foot, just some good pressure. You're not trying to knock down the wall, and relax. Number 5, pull up that pelvic floor, hold it while you press, and relax. Let's do 5 more. Tension through the pelvic floor, pressing, and relax. Number 7, tension again. Hold it, bring it in and up. Foot is going out. And relax. Pelvic floor comes up and in. Press the foot. Keep all of those muscles working together. Let go. 2 more. Pelvic floor. Add the foot. Relax. Last one. Pelvic floor. Add your foot. And relax. Very nicely done. Thanks for joining me today, and thank you for taking care of yourself. I invite you to subscribe to my channel so you'll be notified every time a new video drops, so you can continue taking care of yourself and living that pain-free, active lifestyle that you deserve. Thank you.